I have used the low light level therapy for hair growth for about 8 years. I had a terrible hair fall when I was about 47. My hair was just coming out in handfuls. And I panicked, so I went to the doctor, a hair specialist, and they recommended low light level laser therapy, and I purchased the original laser cap, which I've used fairly religiously for the last 8 years, along with 5% minoxidil foam. That was what was recommended for me personally. Of course, if you have hair fall, always definitely see a doctor for a diagnosis first. But I've been using low light level laser therapy for hair loss for about 8 years. I've been able to maintain my hair density, and I have not had a significant amount of hair loss since then. So everybody's results are individual, but that's just my personal results with low light level laser therapy for hair loss. Also, I've just recently incorporated, in maybe like the last 5 or 6 months, LED red light therapy at-home unit, the Current Body at-home unit, for facial rejuvenation and for anti-aging benefits. I have had several sessions of red light therapy in-office treatments, fairly heavy-duty in-office treatments over the years, and it's really hard to tell when you go once every 3 to 5 years for a red light therapy treatment if it's really working. It's something you have to do on an ongoing basis, and it can get pretty costly when you have to go to a clinic to do it. So I love the fact that they have these new at-home masks. Like I said, I have the Current Body mask. This was given to me in PR, and so my morning routine when I do my LED therapies is a little bit more extended. It takes about 15 to 20 minutes as opposed to my usual 5-minute morning skincare personal care routine. And while I'm doing it, I also have, over the last year, incorporated the Dew eye masks, which I love. I know I talk about these all the time, but I love them. It just gives my eyes that just extra little bit of hydration, and I love them, especially for the winter. So what do I use with all these different therapies? Like I said, for my hair journey with low light level laser therapy, I use minoxidil. I put this on, let this dry down, or incorporate it into my scalp and let it dry down. They don't typically recommend that you have the minoxidil on wet while you're using your low light level therapy. So this definitely has to dry down. It takes a few extra minutes to kind of organize your self-care routine so that you can let everything dry down, because it's the same with the serum that I used before my LED. I'm currently using the Masama Green Robust Antioxidant Serum. It is a bright orange formula that spreads really nicely into the skin. Now on my very light Fitzpatrick 2 skin, it leaves a bit of a tint. But I let that dry down for about 10 minutes, and the benefit of using an antioxidant before you do your LED red light therapy is that it helps mitigate the free radicals. If you're interested in that, I'll link a video or a live down below that you can listen to all the sciencey, nerdy details about that. But basically, it helps the formation of helps prevent the formation of free radicals during your LED treatment. So, like I said, I put on my Masama to incorporate that with my face LED, and I put on my minoxidil, let that dry down, let them both dry down, and then pop my laser cap on and pop my face mask on. And they're each, the Current Body face mask is about a 10-minute session, and my hair session is about 15 minutes. So in about 15 or 20 minutes, I've got that all done. I do end up rinsing the Masama off because it does tend to leave kind of an orange tint to my very light complexion skin, and I just use one of my clean skin club towels to kind of just rinse and pat that off. Also, I find it's a little bit difficult to use this serum over some of the mineral sunscreens that I like to use. It tends to pill a little bit. So I give that just sort of a little rinse off. Then I apply another layer of my Dew. This is a cannabinoid, niacinamide, and peptide formula. They spent 2 years coming up with this sort of proprietary cannabinoid complex. It is not hemp seed oil. It's way more potent than that. And I encourage you to try it if you would like to get a very soothed, calming result from your skin. If you're worrying about or you're dealing with post-inflammatory hyperpigmentation, this serum is calming, soothing, and I've been really enjoying it. It's kind of a milky formulation. Like I said, it's got peptides, it's got the cannabinoid complex, which is soothing to the skin, and niacinamide, which is an all-around skincare goodie. So that is my morning skincare routine when I'm doing my LED therapy. Like I said, a quick rinse just to clean my skin off, my Micellar Green Robust Antioxidant Serum, my Current Body Mask, a little bit of the Dew Serum under my eyes with the Dew eye masks over them. Let that all marinate while I pop on my LED hat for my skincare, and of course I've already put my minoxidil on. So let that all marinate, and then I take that all off. The minoxidil, for me personally, the foam formulation, I just don't have a problem with it. Some people say it leaves a buildup, but it doesn't for me. It just sort of gives my hair a little body, and I can move along with the rest of my hair care. And then I rinse off the Micellar Serum just a little bit, add another layer of my Dew Calming Serum, and then I just pop on my sunscreen and then move on with any of the makeup that I'm going to do for the day. So I hope this has given you some ideas on how to incorporate LED with some really awesome serums into your self-care routine. It's always important to take care of ourselves. I know sometimes I forget, but having this routine in my sort of weekly schedule, 2 to 3 days a week, just helps me feel like I'm taking really good care of myself and my skin and my hair. So if you have any questions, please leave them down below. I'd be happy to chat with you in the comments. Take care, and I hope you have a wonderful day and a happy holiday season.